Welcome, Gyno-Curious listeners. I'm Dr. Amy Novat, and we are here to talk about the vagina. The vagina is an organ that gets a lot of, radio play and daily play, but so many people who have vaginas don't really understand their vaginas. And I have mentioned before on Gyno-Curious, sometimes they don't even know what to call their vagina. It's always part of that down there geography. So Virginia Reath and I are going to talk about the vagina and particularly what happens to the vagina as the perimenopause approaches and when we're in the thick of it. I want to remind you, Virginia Reath has joined me before on Gyno-Curious. I love talking to her about hormones and the vagina and all of that anatomy. Virginia is a practicing clinician, educator, and activist in the fields of gynecology, sexual and reproductive health care for the past 40 years. She knows a lot about this stuff. So listen, we may get too deep into the vagina today or maybe not go deep enough. I don't know. It really depends on you and your vagina. So please, if you have questions or comments or concerns, please write to us at comments@radiofreerhiniecliff.org or call us at 845-307-7446. We really want to hear from you because we're in this little room at the Epicurean, which we're so happy to be at for this podcast, but we're not in the bigger world at the moment. So we're talking to each other and we want to talk to you. That's why we're doing this podcast, to talk to the larger community of female identified persons out there. And we want you to know where your vagina is. We want you to know the changes that can occur in it. And we want you to get pleasure from it and understand when it's not giving you pleasure. So Virginia, welcome.
Good. Nice to be here again.
We're in vagina land today,
Yes.
Okay?
I want to start. I'd have to say one thing right off the bat.
Please.
We definitely don't want to forget the vulva.
Oh, we forgot. I
mean,
forgot to
really,
introduce them. I
the
know.
vagina and the vulva.
It's so true. Thank you
It's
for
V and V.
extending that invitation because it's true. So let's start with, instead of just down there, let's talk about what are the vulva and what is the vagina. And I know that may sound simplistic to some of you out there, but truly, I just want you to understand the anatomy as it is.
Well, I think the way to think about it is the inside-outside or outside-inside.
Mm-hmm.
So the vulva is the entrance, you can say, of the vagina, or you can talk about the vulva as its own entity because it has many important factors and very important features. Primarily the clitoris, which sits above the entrance of the vagina. Then if you're going from, sometimes people are like, wait, what are the holes up there? And so I often say, okay, if you start from the very bottom, you have the anus, then you have the vagina, the urethra, and then the clitoris, okay? Trying to get your location correct.
And the clitoris is not a hole.
And that's right. Sorry,
just to
the
let you know
clitoris
that.
is not
Yep.
as whole,
Yep,
but
yep.
it does have an entrance
Mhm.
and it has a hood. So the vulva is important also, and I think I mentioned this when I was on last, but one of the things that's been very funny was that in the last 2 years, there was this great announcement that they'd come out with an understanding of the true clinical structure of the clitoris. And it basically looks like a praying mantis. And what I say that is the hood and the gland of the clitoris is then extended down into the labia, okay? So the idea that the clitoris has nothing to do with the labia or clitoral stimulation or erogenous zones don't include that. And we should do a whole show on the clitoris. And it's an entire anatomy because it's pretty fascinating. And it's actually one of, if not the largest network in the body of both men and women, which is pretty amazing.
Of nerves.
Of nerves, sorry,
yeah.
yes, of nerve.
And I want to also just articulate, because Virginia just used a couple of different words. When we talk about the vulva, they could be called the external genitalia. They could be called the labia majora and labia minora.
Right.
So again, there's a lot of words, descriptive terms that are all anatomically correct, but they're all talking about the same structures.
Right,
So
the same area.
Yeah.
So one of the reasons that we think about it in the perimenopause is because, as we said in our other section on perimenopause, is that you're looking now at a period of time, anywhere between 2 to 5 to sometimes 7 or 8 years before the onset of true menopause, which is the absolute ending of all periods and ending of secreting estrogen and progesterone and testosterone, you begin to see some changes in the vulva.
Yeah.
And initially, and some of that can be discomfort. Some of that can be an itchy feeling. Some of that can be a stinging feeling. Some of that can be a general irritation. And so
I'm going to add to that list.
yes.
My vulva are disappearing. Where'd they go?
Well, that's
Where'd
the
they
other
go?
thing. Yeah. Well, that's what I was about to say. So the tissue itself, but then the poof leaves, the plumpness of the actual labia.
Right.
And the vagina can sometimes, and this is more happening in menopause, but the vagina can almost fall open a little.
Mm-hmm.
So the perineum, which is the area between the anus and the entrance of the vagina, that can flatten out a bit.
Mm-hmm.
And so it's less of an enclosed structure and a little bit more open. It can become looser and thinner.
It can also change color.
And
right?
it can change color.
Mhm.
It can become paler, not as pink, not as plump and plush.
So let me stop you there
Go
because
ahead.
I just had the memory of the 60s and 70s where everybody was taking mirrors to their vulva and vaginas. And does this mean you need to be looking at your vulva every day? No, of course not. But certainly if you begin to get symptoms that we're going to go into in more detail and you're beginning to realize that something is shifting, yeah, take a look. Take a look. Or start before then. Take a look at what your vulva looked like when you're 20 and maybe again when you're 30. And just appreciate what your norm is. Because again, just like the rest of our body, the way my vulva looks may be quite different from Virginia's vulva, even when we're both 20. Again, just knowing your body, that's what we're here to talk about.
Yeah. And also one of the things that happens, I mean, just another thing that I think about because I've run into it as an issue, the hair that we have in the vulva, okay, does serve a purpose.
Mm-hmm.
It creates an airflow to the tissue and to that whole area, which we cover pretty much extensively. We're not walking around without our clothes on very much unless you're at the nudist camp.
Right.
Or in your house. Reason I mention that is because lots of women shave or wax their pubic hair. And sometimes that can lend itself to more sort of irritations, especially as we age.
Right.
So I just wanted to mention that as something that can happen.
It's protective. The hair is there for a reason.
Yeah, and it's a buffer. It acts as a buffer.
Right.
As it changes, when we were talking about, lots of the things that start to happen are, again, due to this lowering level of estrogen. So when that happens, we tend to have, and so when the skin is looser and thinner and a bit drier, you can have symptoms of that. You can feel it. As I said, wiping, sometimes for some women, even wearing pants is uncomfortable.
Yeah.
One of the other things that happens that's true of the vaginal tissue.
So let's talk about what the vagina is. Let's just remind people that the vagina is a cylindrical cavity that once you are, again, starting from the outside looking in, if you will, most of us don't see the inside of our own vagina, let alone other women's vaginas. Virginia and I have been blessed with a career where we see
Front
a lot
and
of
center.
this. Exactly. But so it's this canal through which menstrual blood flows, through which babies are delivered, into which penetrative sex toys are placed. And it's a cavity that is got a very sensitive inner lining. And we're going to talk in a moment about what happens to that lining. But it is that cavity that, again, you look at the external genitalia and then you're going in. And this is a closed space. At the top of the vagina is the cervix. Some women envision that there's a space up there, an opening that things can get lost. No, things can't get lost. It's a closed anatomy, but everybody's got a different size vagina, depth of the vagina. Some women have very long and capacious vaginas, and others have very short vaginas.
Right.
And this is, genetic. For some women, it's a result of treatments that have happened or lack thereof. So now that we've got the anatomy really clear,
I want to add one thing.
Please.
Okay,
please
sorry.
do. No.
At the very entrance of the vagina,
Mm-hmm.
lots of times women will start to feel this kind of raggedy edge, this sort of thickened bunch of tissue.
Mm-hmm.
And so I've had a lot of women come and like, what's this?
Right,
You know?
right.
And what that is, it's actually the hymenal tag. So the hymen is a membrane that sometimes is closed and sometimes it's usually not closed completely, but it can have a small entrance to it. But that's when the hymen is stretched by lots of different things. It can be sex, often. It can be a bike. It can be riding a bike, riding a horse.
We're born with this.
We're born with this.
Yep.
But when it's opened, you get this kind of thickened tag at the entrance of the vagina. And sometimes it can be quite large for some women. Sometimes women don't even notice it.
Mm-hmm.
But it becomes an issue when we're going to talk about now the changes. And when that tissue gets a little thinner and a little bit more sensitive, that area can start to be pretty sensitive. The second thing I want to just call notice to is, remember, the urethra, where we pee, is on the roof of the vagina, okay? So think about friction, all right? So it's hitting the urethra, all right? So just so that you, because we mentioned, I think we mentioned that sometimes you have an increase of urinary tract issues, but we're going to get to that in a second.
Okay, so you started to describe what are the symptoms of the perimenopause, again, when the hormonal environment is changing, and specifically progesterone is dropping, and then then estrogen is dropping. And remember, the vulva, the vagina, these are organs that have estrogen receptors. This is where estrogen has activity, if you will. And that activity is about lubrication and elasticity and plumpness. And so as these hormones begin to drop, that's when these symptoms begin. And Virginia, you've already mentioned some of the changes of the vulva. Can you talk about the changes in the vagina that women might feel?
Yeah. First of all, the estrogen has contributes a slightly acidic environment to the vagina, which keeps it in a healthy balance of different bacterias, different yeast organisms. So one thing, you may see a little increase of vaginal irritations and discharges. The second thing is that the vagina has these ridges in it which accommodate for friction, and those are called rugae. And what happens over the course of the beginnings in the perimenopause and comes true more closer to menopause is that these areas flatten out. And so what you get sometimes is a skin-on-skin friction kind of irritation when you have any kind of penetration.
Or one wall of the vagina is hitting the other wall of the
Right,
vagina. So
exactly.
It doesn't even have to be penetration, but just
True.
sitting within your own body.
Right.
Yeah, I like to say our hills become valleys and our valleys become hills. Like, it's just the topography changes.
Yeah, sure. So the two areas that can relieve some of this is that, one, we have what we call moisturizers. Okay, so these are products that really just serve to moisture the vagina. And they're often interchangeable, seriously, with the lubricants, but sometimes they're slightly different. You might have KY jelly, one that certainly was a staple for our generation. However, lots of women will notice that a lot of the water-soluble products tend to get sticky after a while and create a kind of tackiness to the vaginal tissue, which can actually be more uncomfortable after a period of time. Then there was Replens that came out of the KY, and that has a certain element of more moisture given to the tissue. So then again, that can alleviate a lot of the discomfort. The main thing, as we've been talking about, is this lowering level of estrogen. So often, if you come and you have a complaint of that, your clinician may well prescribe some kind of estrogen product. And there are lots of different kinds, and I'm just going to go over the names that you may have heard and what they are. So those medications are something called Estrace, which is a vaginal estrogen cream made with estradiol, very common estrogen that was used both in systemic treatments like the patch, oral, and also vaginal. The S-string or the Fem ring, this is a rubberized ring that secretes a small amount of estrogen every day, and it's good for 3 months. in the vagina tissue. You keep it in.
I'm just going to articulate. So the E string is localized to the vagina.
Right.
So again, it's this little circular
Dome.
device
Right.
that sits in the vagina for 3 months at a time and just local, where the fem ring is a higher dose, so it gives more systemic effects. And so they're similar in appearance, and they are similar in that they both have estrogen in it, but they have different impacts and dosages. So just
they have
bear that in
different.
mind.
One's low and one's much
Right.
was a little bit higher.
Right.
Then there's Vagifem. It comes as a tiny blue bioadhesive tablet, which has a very annoying long inserter, which is annoying only in that it's a kind of, what did we say?
It's not earth friendly.
It's not earth. It just feels, a lot of women actually end up not wanting to use it because it's so non-ecological in that they could just give you one inserter and a multiple group of these pills.
There are estrogen suppositories that you can get without applicators too.
Right. Well, that's the Imvexi, which is a little tablet, like a little pearl shape. And that's, again, you insert that. And these are often inserted sometimes twice a week, sometimes more. One of the things that happened with the Vagifem was in the beginning, it was a higher dose and you only needed to use it twice. Then, from a marketing standpoint, they thought, oh, this is good. Let's lower the dose and make them need more. So you may, in fact, need more than the 1 or 2 nights, but it basically releases the estrogen over the course of time.
I'm going to interject right now. So a couple of thoughts. One, just to kind of back up a moment. So when one is experiencing these changes with the perimenopause in the vagina, on the vulva, there are different ways to treat them. And what Virginia was beginning to describe were there are vulvar vaginal moisturizers and there are vulvar vaginal lubricants. And lubricants we're going to get to, but those are associated with penetrative sex, masturbation, when you're putting something in the vagina. Or even some people will use those lubricants on a daily basis, just as they interface with their panties and pants.
Right.
Where vaginal moisturizers are designed to work on the tissues over time. So whether it's estrogen, whether it's products like hyaluronic acid, whether it's natural oils. I know a lot of women who use like vitamin E suppositories or coconut oil or natural almond oils, and they're using it as moisturizers. Now, some of them use it also as lubricants. So it can be confusing out there, but they're typically, meaning that some moisturizers can act as lubricants and some lubricants can act as moisturizers, and you got to play around with it. So whenever you go out and buy these things or ask your doctor for these medications, get a small number, unless your insurance pays for more for 3 months. That's that trick. But what I mean is always start with small numbers because you don't know. For one woman, coconut oil is the answer to her prayers. And for others, they're like, ooh, it's stinky, or I'm allergic to coconut oil. I can't use that stuff inside of me.
Right. So for instance, there are some issues with some of the more medication-based estrogen supplements to the vaginal tissue. Some people have issues with Premarin, and some people even have issues with estrase, that it can be irritating.
That's
so
right.
Again, these are vaginal estrogen supplementation to the vagina. One of the Amy just mentioned it, but one product that's become incredibly popular in the last several years is hyaluronic acid suppositories for the vaginal area. Turns out that a study was done about, over 10 years ago now, or just 10, which was that hyaluronic acid that many of us see in face products and moisturizing and hydrating aspects for skin, turned out to have a very mild estrogenic effect on vaginal tissue. So now we're seeing an increase of these being very readily available. The one that's most known is made by Bonafide, and that is the Reverie, and it comes as a small egg-shaped suppository, and you can use that several times a week to help with vaginal dryness and irritation, and it acts as a small, as I said. So sometimes what you still are going to have is, as Amy was suggesting, with penetrative sex, you may still need a lubricant. And that's actually ends up being important. And I think actually not just with penetrative sex, I think for a lot of women who are doing masturbation, where you really need something that's creating a buffer, a glide factor, and that's really what you're getting at with a lubricant. So some of those are the lubricants you've heard of are like Astroglide and Uber Luber, and there's so many that it's hard to. I did make a list of some of them.
Oh, it's endless.
It's endless.
So again, there are. How do you choose? Women are often saying, "What do you recommend?" And I have a list in my office of the more commonly described or promoted by women I speak to. But again, you got to try it out yourself. I also recommend that you do a spot test. What I mean by that is you put a little bit of this product as best as you can. Even if it's a suppository, you can warm it up in your hands and then rub it on the inside of your thigh. That tissue is very sensitive. And do it several nights in a row. And just make sure that you're not getting redness or swelling or stinging or irritation before you put it in your vagina. The other thing I want to discuss, Virginia, talk about, because we talked about the vulva and we talked about the vagina, and they're internal and external. It's true that I might put a suppository in my vagina, but it never gets to my vulva.
Well, that's
so what do you do? What do you do?
That's a big issue because one of the things that, especially with a lot of the products that they use for vaginal application, do not reach the vagina, except the creams can.
Don't reach
vulva.
the vulva.
Sorry.
Yep.
So the vulva is very important, especially the entrance area that we were talking about earlier. So having a prescription of some kind of estrogen cream is very useful to have, just even with your finger, a small amount on a weekly basis, several times a week. The second thing also is we're leaning into it, but we're also talking about increased blood flow, okay? We want blood flow to this area. And what happens, we have a natural sort of avoidance. If all of a sudden your vaginal tissue, whether you're single, without a partner, starts to feel a little irritated, you may not be so prone to be masturbating, to be getting blood flow to that area. Or if you have a partner, you may find you're begging off a little.
Mm-hmm.
You're not so into it because it's,
that's right.
That hurts. Or it's just not as comfortable. Or it takes me longer to have an orgasm.
Or the other thing I hear is, he used to do this to me, and man, I would have this great orgasm. But now it's numb. He can do it, and 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 it ain't happening.
Right.
So there can be this array of responses, which then affects, as you put, you avoid sex, but it changes the way you feel your experience with libido.
Right.
Women will often come in and say, my libido's down. I just don't feel like I'm interested in my partner anymore. And the first question I always ask is, are you experiencing any pain with sexual intimacy? And almost always, if they say yes, I'm like, that's the reason you have no interest. You're a smart woman.
Right.
If you feel pain, why would you want to?
Well, it's also
have
true
sex?
that the vaginal tissues have a very astute and sensitive muscle memory.
Yeah.
So if you've just had any kind of discomfort, you are going to, your body, what happens is you may be very turned on in your head.
That's right.
And you may be very turned on in your body. But your vaginal muscles start to tighten up and contract because they're saying, it hurt the last 3 times.
Right.
I don't want to don't do this. So that's another thing that can happen with vaginal discomfort.
So women, please, if you're experiencing discomfort with sex, this is not normal. It's expected, meaning it's physiologically a true phenomenon. But do you have to suffer through it? Absolutely not. And particularly, I'd like to point out in heterosexual couples in particular, anybody who's having any kind of penetrative sex, that you got to talk to your partners because your partner may not have any insight, particularly if they have a penis, about pain because they're not experiencing pain. They're still getting pleasure. So you're having to say, whoa, we got to change things up. We either got to use this lubricant or we have to use I have to use a moisturizer, or you got to penetrate slower, or you can't penetrate. And women are often hesitant to say something out loud. So Virginia and I are here to also, scream it, if you will. You do not have to suffer silently. There are just a whole host of different interventions that you should be looking into or asking about.
Absolutely. I just also want to mention 2 things because I forgot to before. The two types of lubricants that are available are water soluble, three types, water soluble and silicone and hybrid. I tend to always recommend silicone for my older patients from perimenopause to menopause.
Because last.
It lasts. The glide factor really lasts. And that, even male partners will sometimes say it feels different. Like the patient will come in and says, he says it feels all different. And a lot of times it's because they can feel the tightening and they can feel the skin changes in the tissue. So the lubricant ones, I think the silicone ones are very excellent because they really last a long time. I also just wanted to make sure to mention there's a lot of CBD products right now that are being used vaginally, with a lot of people really being very happy with the effect that they have on the vaginal tissue. So that's another option. And then also in Emirata, that is a product where you can buy estriol, vaginal estrogen. It's not vaginal estrogen, it's just straight estriol. But it turns out that the vagina has a lot of receptors for estriol. And so this also can be something you can buy over the counter without a prescription and use it externally on the vulva and then at the entrance with your finger. The other thing is, don't be afraid to put your finger in your vagina and explore a little bit what's happening.
Right.
And where you might have some discomfort.
Right. So I just want to clarify, there's several types of estrogens. We've mostly spoken about estradiol. That's what's in most of these pharmaceutical company products. But as Virginia just mentioned, there's this other estrogen, estriol, and there are some products out there with it instead.
It's the weaker estrogen.
Right, right. So there's not a lot of science around it in terms of its use, but I've had many patients talk about its value. They feel it works better for them, in fact. So, yeah. So, again, I think that the goal during this time, as your vulva and vagina begin to shift and change, and again, as you'll hear us talk about over and over again during this conversation about the perimenopause and menopause, not everyone experiences this. We've talked about the 70-year-old who says, my vagina feels great. And then we've talked to a 35-year-old who starts to say, something's changing. So there is no absolute, it's universal that there can be changes, but in varying degrees. And it can change over time, of course. Just continue to listen to podcasts and read books and ask your clinicians about the options, because the lists are long in terms of moisturizers and lubricants, and even the products for the vagina hormonally are they're just more and more of them out there. So please ask. And there are women out there who can't use estrogen. And so I want to remind you that, again, hyaluronic acid has been extremely helpful for those who can't use estrogen. There are other products coming out that may be just a perfect solution for you, your vulva, and your vagina. Yeah. Virginia, do you have anything else you feel like we should necessarily add to it, knowing that the next time we talk, we're going to talk about the post-menopause, and vaginas will come in there to some degree. But anything else you want to kind of remind people?
Thing.
Please, go for it.
I have one thing that's a pet peeve.
Okay.
So many of us have heard about the G-spot, right? So the G-spot was named by Dr. Grafenberg and discovered, quote, 20 years ago, unquote. However, I want to make sure that we know our anatomy. The G-spot is not in the vagina. The G-spot is the clitoral nerve bundle that you feel through the vagina.
Mm-hmm.
So when people say, especially, and this is true just with vaginal changes, when people are like, where's the button? I can't find that thing. Where's that nub? Where is it? And I'm like, no, you have to be aroused for the clitoral area to be expanding, so then you can feel it through there.
Right.
So it's a big peeve of mine. I just wanted to correct the anatomy. And also, so now we can really call it correctly the C spot.
I like that.
And not the G spot.
There you go. So the other words that you vulva havers are going to hear out there is vulvovaginal atrophy, the genitourinary syndrome of the menopause, We didn't talk about it, but we will in our next podcast about how the urinary system is affected by these hormonal changes as well. So there's a number of different terminologies that are utilized, and don't let the word atrophy scare you.
Just let it make you angry.
There you go. There you go.
Don't let it get you scared.
That's right.
It's really, can we just throw that word out,
That's right.
term out?
Demand a different word if it bothers you.
Demand new language.
There you go. And talk about this. The more we normalize all these body changes, if 51% of us are going to go through this, then we really need to normalize it, demystify it, get rid of the myths around it. It's not only your responsibility to make sure sex is comfortable, your partner has to participate. There's communication that's absolutely necessary. Find words, any words that help you communicate with your partner. Not everyone is comfortable saying vulva, vagina, genitalia. So if you got to use other words, but just talk about it. Yeah.
Great.
Virginia, thank you so much for joining me.
Always fun. Thank you, Amy.
And thank you to the producers here at Radio Free Rhiniecliff, Matty Rosenberg and Jan Hammoud. Thank you also to the Epicurean, Patricia Wind and Cliff Platt, who make this podcast really a reality by giving us the space in the Epicurean. Come to the Epicurean. There's so many yummy things here. It supports local farms and farmers. And again, please let us know your questions and concerns. Write us at comments@radiofreerhiniecliff.org or call us at 845-307-7446. And please, a reminder that one of the ways in which to promote Radio Free Rhiniecliff, but also this program, is to go to Apple Podcasts, go to Spotify, and give us your likes, share, particularly Apple. Give us 5 stars and make a few comments. You can just say, I like it or I don't like it, whatever you want to say. But those comments alone generate buzz and promote the show. And my goal is to spread the word about all of this outside our small community to a larger community, to women across the world without sounding grandiose. I want us to talk about these subject matters with joy and diminish fear, and to just empower us and our bodies.